We're the oldest regional medical center and the largest regional medical center in this neck of the woods. We are more than 125 years old.
We are a level 3 NICU, and so we do take care of some of the smallest fragile babies that come into this world. And one of the things that they can be susceptible to at a higher rate is ventilator-associated pneumonia.
So we can look at the checklist and see if maybe she's ready to be extubated. Ventilator-associated pneumonia is a very severe complication. It means that a baby is going to be on a ventilator longer because they're sick from pneumonia. So it increases ventilator days, which increases lung injury and complications related to chronic lung disease.
Her gases are good.
It also costs money because you're having to give antibiotics, you have more vent days, the baby is sick, and some babies can die from ventilator-associated pneumonia. But her FiO2 is less than 40%, her tidal volume is low.
We have a great history here in our organization for quality improvement and in really incorporating that in everything that we do. And so the hen was just a natural fit for us. Okay, so when we look at the data that the hen is providing us, it really provided us with additional resources that really helped us to identify whether or not some of the work we currently were doing were already reflective of best practices. So we've prevented 3 ventilator-associated pneumonias to date, and what else we could do with those resources to enhance some of the work we were doing. It turns out to be a cost savings of $129,000, so that's really good.
For this project, we did educate the parents about what to expect.
How are you feeling today?
I'm good.
That's
hanging
good.
in there.
Good.
Parents were taught to do oral care so that if they were at the bedside, they were able to do that care for their baby.
We can teach you how to swab your baby's mouth, and that will help prevent bacteria in the baby's mouth.
The Hospital Engagement Network has provided many resources on their webpage in particular, where they do have information on all of the different areas of focus. For example, the top 10 best practices that one should implement in each of those areas. And so we're able to take information like that within our own organization, then do a gap analysis and identify what are the things that we're doing really well and what are some of the best practices we should be considering and implementing.
We think it's very important to put performance metrics before everyone's eyes, so we're big believers in transparency. We currently have LCD screens outside of our adult critical care unit as well as our neonatal intensive care unit that really displays our metrics on quality and patient safety.
As far as ventilator-associated pneumonia, I think we pretty much have said this is what we do. We know it works. That having the checklist of all the criteria for extubation has helped us improve. And once you get to that point, it's all about maintaining the gains. You don't stop looking at your data. You keep looking at your data. And if you have a blip, then you have to say, why did we have a ventilator-associated pneumonia? What was different about this baby? What was different about the care?
We're extremely proud that we have not had a ventilator-associated pneumonia in our neonatal intensive care unit since January of 2012. And that's a huge accomplishment.
Thanks for tuning in to HNHN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.